I'm Dr. Jim Spears, and I'm an orthopedic sports medicine specialist. My specialty is orthopedics, but my emphasis is on sports medicine. Basically, that means that I spent a year after my orthopedic training doing another year of learning how to take care of athletes. Basically, that means I do their shoulders and their knees. It also doesn't mean I'm just taking care of young kids who are in high school. It's also other people who would be older who have athletic injuries. No matter what, even though the high school football players tend to get hurt because they're playing football, the 40-year-olds get hurt a lot more. They're still weekend warriors and trying to play racquetball, and they're much more prone to it. So I would say that I'm going to see probably 70 to 80% older patients, meaning in the 40s, versus the high school kids. A big part of my role is being an educator. I mean, every patient that comes in that has a problem basically needs to understand what's wrong with them, what we're going to do to take care of them, and why. And when they understand that information, it makes them be a better patient. Every surgery is going to be unique, what's going to be required of them. Once we put that new knee in there, we need to get it straightening and bending, and you're not going to feel like doing that day one. And so it's an educational coaching program to say, don't try and win it all today, let's just get through this next week, and then every week it's moving along. And that's where I really count on my physical therapists, because these patients are going to therapy 3 times a week, and they're their daily check-in. You know, I don't see them maybe for a week to 10 days, and so the therapists are really helpful in guiding them that, yes, that's the amount of pain you should have, and here's what your expectation should be. So yeah, so they're in the hospital for a day or two, and then they're out on therapy. You know, I think the results in the end, I mean, people come in with fairly complex, significant problems. They can be fairly miserable and painful. It can be something they've had for a long time. And we have procedures that can really be life-changing for them. You know, they've always wanted to run that marathon, or they've always wanted to be athletic, or they just wanted to play with their kids and throw the ball, and now they're finally able to do that. So I think it's very rewarding that people are able to really impact their lives and change it in a very positive way.